In this video, I am showing you how to treat lower back and thoracic pain in one session. Before I start, don't forget to subscribe to my channel and let me know in the comments below if you ever had a similar treatment when you went to see a therapist. This video is for professionals who have training in manual therapy, and it is not something to reproduce at home if you are not qualified. Patient complaints of low back pain and intermittent thoracic spine stiffness that started a few months ago. There was no specific incident that caused this pain. Patient is having a desk job and prolonged sitting makes the pain worse. First, we start with an assessment as usual. In this video, I am not showing any assessment techniques. This video is just for the treatment techniques. Don't forget, best advice is to clear the red flags so you are safe to provide treatment. I start by using the blade to release the fascia. Fascia is a thin layer of connective tissue that surrounds and supports every part of the body, including muscles, organs, bones, nerves, and blood vessels. It's made up of multiple layers, each separated by a liquid called hyaluronan, which helps fascia stretch and move smoothly. Next step is to do a deep tissue massage using my hand to release the muscle tension. My advice is to keep it in this order, so first release the fascia and then you start doing a deep tissue massage. In this way, you can have the best possible results. If you don't use the blade technique and you only do a deep tissue massage, the tension and stiffness will come back after a few days, and patient will start having the same symptoms. If you feel that there is still a lot of tension in a specific spot, you can still use the blade even if you've done a deep tissue massage. You can combine the blade technique and deep tissue massage, but the most important rule is to start with the blade. I hope you like this video. Don't forget to subscribe to my channel, and if you have any questions or suggestions, leave me a comment.
You okay?
Yeah, I'm good.